Hello everyone, welcome back to my channel. My name is Pinky. I'm the clinical pharmacist practitioner. Today I'm going to discuss about a very hot topic, and it is alopecia, means hair fall. Before I start the topic, I would like to thank everybody who has supported me immensely, followed my Facebook page and subscribing my YouTube channel. That means a lot. And thanks for your messages requesting for so many topics that I should cover. Hopefully, I'm going to cover them in the future. Hair loss is very common. There is nothing to be basically worried about. We can lose like 50 to 100 hairs per day, which is very common. And hair loss can be due to many different conditions, such as it can be due to hereditary, like it runs in the family. It can be due to hormonal changes. It can be due to medical conditions. It can be due to medications. It can be due to supplements. It can be due to radiation therapy, chemotherapy, that is the cancer treatment. And it can be also due to stress. So don't get stressed out. And it can be also due to hairstyles and sometimes hair treatments. Treatments such as using excessive heat in the hair and using harmful chemicals in the hair. Alopecia is the medical term for hair fall. Now, alopecia can be of two types: androgenic alopecia and alopecia areata. Now, androgenic alopecia, androgenic hair fall, it can be due to hormones in the body, and it can be also due to medical conditions such as polycystic ovary and acne. It can be somebody has got irregular periods, infertility problems. Then it can be suspected that it is androgenic alopecia, and it's mainly basically it can be hereditary. It can be someone has inherited it from the family, or it can be just because of medical conditions, hormones. So androgenic alopecia, in men it affects 30% under the age of 30, 50% of men under the age of 50, 70% of men under the age of 70. In women, it affects 50 to 10% pre-menopause, before menopause, and 20 to 30% after menopause. Now, we are going to talk about the treatment of androgenic alopecia. So, for men and women, topical minoxidil can be used, 5% in strength in men and 2% in women. And this stops hair loss, but the hair loss will resume as soon as you stop the treatment. And however, there is no systemic side effects to minoxidil. For men, finasteride 1 milligram can be used, and it can stop hair loss basically, but only for the duration of the treatment. However, there are evidence that if you use it for over a 5-year period, then only you can see the benefit of finasteride, that it is working. However, finasteride does come with certain side effects, such as decreased sexual function, which is a very important thing for many men. So keep that in mind. There are also some evidences that finasteride can cause depression, and there has been an MHRA has issued an alert that if finasteride is causing depression in any man, it should be stopped immediately. Now let's talk about alopecia areata. Alopecia areata, it's an autoimmune condition. Basically, it's a genetic condition. And alopecia areata is of two types: alopecia totalis, which is all of head hair loss; alopecia universalis, which is loss of body hair. Now, in this condition, there will be circular bald patches, and there will be very few hairs. And in this condition, 33% of hair will regrow in 6 months' time. 50% will regrow in 12 months' time. However, 30% will never grow. Now let's talk about the treatments of alopecia areata. To treat alopecia areata, we have to refer patients to secondary care, like to the hospitals. And what can be used, like intralesional corticosteroids. Corticosteroids such as triamcinolone can be used. It is the first line. Then as a second line, diethranol can be used. Now diethranol, what it does is that it causes low grade dermatitis, like itchiness in the scalp, and which stimulates the hair follicles to grow. Then there can be topical immunotherapy, and there can also be potent steroids or less potent steroids in the form of a foam that can be used as well, but there are like limited effectiveness. There can be systemic corticosteroids as well. However, it comes with systemic side effects, and minoxidil can also be used. However, minoxidil is beneficial in preventing relapse rather than to. Now losing hair can be very distressing. It can be very painful, and it can be emotional as well. Now if you think that you're emotionally down, that you're losing hair, please do seek help. Approach your healthcare professionals for advice. And yeah, pretty much that about hair fall. So if you have any questions, pop the questions in the comment section below. Thanks for the immense support. Like, you guys have supported me so much, and thanks for liking my videos, watching my videos. And I hope I'm gonna get more motivation from you guys in the future. So do like and subscribe my channel and share, and stay safe. Thank you so much. Bye for now.